What's going on, guys? Dr. Greg here with Movement Driven Performance Physiotherapy. Today's video is going to be kind of an introduction to what we're going to be discussing a lot throughout this blog post and throughout the month of February 2023. We're going to go a lot over how to get better shoulder mobility and better strength and less shoulder pain, specifically when we're reaching overhead, when we're doing a push press, when we're doing shoulder press, when we're doing a clean and jerk, whenever we're getting up here. We get a lot of pinching in the front of the shoulder. And there's a lot of different components that make up a successful movement pattern, an efficient movement pattern, and to build strength and mobility of getting up here, right? It's not just the shoulder joint. There's a lot of different components that go into good overall movement into that range. So let's kind of go over a few of those now, and then some follow-up posts or more in this blog post itself. You're going to see some more detailed instructional videos of how to improve upon those different parts of shoulder mobility or overhead mobility so that we don't continue to have impingement or rotator cuff type issues in the top of that movement. All right. So the first thing we're going to talk about is how the thoracic spine leads into overhead mobility. Okay. So our thoracic spine is this area of our back between our neck and our low back. This area is super important in terms of it needs to be mobile, it needs to have flexibility and the ability to move to get overhead, okay? So when I reach overhead, I need thoracic extension to be able to get here. So if I exaggerate poor posture and I have this, what we call a kyphotic posture in the upper back, so that means I'm rounded forward. If I have that excessive rounding forward and I'm not able to extend up, then what happens is I'm automatically limiting my overhead mobility. I can't get here without my spine moving. Okay, so that's the first component. We need to make sure we have thoracic spine mobility. Then that leads into, is my shoulder blade moving well and moving the right way in terms of a mobility standpoint and a strength and stability standpoint, okay? So that gets to a lot of complexities, but let's kind of break them down. So when I reach overhead, we talked about I need that thoracic mobility. The second thing I think about is we need that shoulder blade to be able to rotate the right way. So when I reach overhead, 2/3 of that motion is coming from my shoulder joint itself, and 1/3 of that motion is coming from my shoulder blade rotating upward. So as I lift up, my shoulder blade is rotating this way to help me achieve this motion. It's coming around my rib cage. Now that thoracic mobility comes into play. If I can't do this, then that shoulder blade can't rotate the way that it wants to. But what I really see is not necessarily a lack of mobility of the shoulder blade. It tends to be more on the stability side of things, where we aren't recruiting the muscles the right way to achieve that upward rotation, okay? So there's 3 muscles that achieve that upward rotation. All right, so I have my beautiful drawing over here, okay? So don't mock my art skills, but I want you guys to kind of get a visual of what's going on in the shoulder blade. So there's 2 muscles that are really driving that upward rotation, okay? And we kind of separate one of those muscles into 2 different ones, upper trap, lower trap. So we have our trapezius muscle, our serratus anterior muscle, and like I said, we're dividing the trap into upper and lower trap because of the way that the fibers are oriented. They kind of do different functional things. Let's go over what's happening in those muscles when I upwardly rotate, or when I reach overhead, and that scapula, that shoulder blade, has to upwardly rotate. So as my arm goes up overhead, what's happening is I'm getting the upper trap to pull this direction. I'm getting the lower trap to pull in this direction. And I'm getting my serratus anterior muscle to rotate in this direction, okay? So when those 3 muscles are firing together, they're pulling in a way where they're creating that upward rotation to assist. What I see a lot of time in my practice is that the upper trap tends to be this muscle. We hold our stress there, we overutilize that muscle. It's sometimes going overboard to help the shoulder and the neck and be this kind of stabilizer when it's not supposed to be. It's supposed to be this bigger muscle for bigger movements, but it tends to be this muscle that's kind of always on and not really performing to the level that it needs to. But it's overperforming because the lower trap and the serratus aren't doing their job. So what I see is we start to hike up this way because this isn't doing what it needs to be. And if this is pulling, it pulls up and in, and we're gonna have this kind of shrug shoulder. So when people reach overhead, they get a little shruggy. They start to get all of this beat up and painful and tight and muscle knots in there. And it's a lot of it because the lower trap and the serratus anterior are not doing their job. They're not pulling their weight, and the upper trap's doing too much work. So the second part of overhead, overhead mobility and strength is the ability to learn how to fire the serratus and the lower trap and tell that that upper trap to kind of calm down and not do so much work. And then that way we start to alleviate some pain over time. So we've talked about our first two components. We have thoracic mobility and we have scapular or shoulder blade stability, or the ability to move it the right way and be in control of that movement. And then it comes to the shoulder itself. Now when we're talking about shoulder mobility here, we need the actual shoulder joint, which is called our glenohumeral joint, to make sure we have mobility. And typically we have a little bit of stiffness at the end range. So we need to work really well at gaining some capsular mobility. So we have our ball and socket joint, and around that joint there's this really thin layer of fibrous soft tissue that can tend to adhere and make it tough for that joint and that ball and socket joint to move the way that it's designed to. So typically we need to work on shoulder joint mobilizations. A lot of the time we need to work on internal rotation here, as well as external rotation towards the top of the joint to allow that joint to have more space so that it can move the right way. Sometimes it's not just shoulder mobility in the joint, it's muscle flexibility, and that lat tends to be a big contributor, as well as some other muscles that tend to be internal rotators. So the pec, subscap, teres major, and lat are four muscles that do internal rotation, and they bring the arm toward the body. So when we go here, we're stretching all of those muscles, and if those are tight or they're in this kind of spastic mode, they're not allowing you to move the joint well, and they're going to contribute to some inability to reach overhead over time. And then from there, it's again regaining some strength of the delt and of the rotator cuff muscles in that range, and they have to work really well with that upper trap, that lower trap, and that serratus anterior. And we call that kind of a muscle synergy. All of those muscles have to synergistically work together as a team to do everything that we're trying to do, no matter what movement we're talking about. In this case, the shoulder, to get overhead, and then to be able to really be strong here and not to hike and not to let the lat get weak or anything like that. So just to review, thoracic mobility, scap stability, shoulder joint mobility, flexibility of those muscles we just talked about, and then stability of rotator cuff and delt in this position up here. So lots of different components to make this simple movement really good and really feeling like you're not jamming and pinching at the top of that range. So I hope that kind of summarizes what you need to work on. Now continue to click through the rest of this blog post and find ways that you can improve upon all of those different areas and get your overhead press feeling better than it has. And when you feel better, you move better, you can build strength better. So if you want to hit these performance goals, it has to start with those basics. Hopefully that was helpful for you guys. Hopefully you'll find the rest of this post really helpful as well.